first thing that I'm going to do is I'm going to check that I have an order for this particular procedure and that along with the order that my patient has met the indication for this procedure. So if the order says place a Foley catheter after 8 hours post-op with no void, which means they weren't able to go to the bathroom after surgery, and we've done 8 hours of them trying, I need to put a catheter in. So my patient has met the criteria and I have an order. Then I will go to the room, introduce myself to the patient, explain the procedure that I'm going to do, which in this case, Mr. Jones, how are you doing today? I'm washing my hands. You doing good? And I've already name bracelet. It's on this side. Can you go ahead and tell me your name and date of birth? Very good. All those answers are correct. And then I can tell Ms. Jones that today we're going to be putting in a Foley catheter because you were not able to void by yourself, and it's been 8 hours since you've had that spinal anesthesia. And in that 8-hour time, it's possible that you may have a liter of fluid in your bladder right now, and that is dangerous for your health. So we're going to go ahead and put Foley catheter in to drain that urine. Do you have any questions for me? No? Okay, great. I'm going to go gather my supplies, and I'll be right back. And then I gather my supplies. My supplies include gloves, clean gloves, a barrier to lay under my sterile field, a towel or chuck to lay under my patient, and my Foley catheter kit. If I already know that my hands are not going to fit inside the gloves inside this catheter kit, then I'll have secured an additional pair of sterile gloves before I enter the patient's room. But I can work with these, so that's fine. I'll perform hand hygiene again and go ahead and set up some of my items here. I'll make the bed at a height that is okay for me to work with so that my back is not strained. And then the position that we'll want to put our patient is head down. We do want to assess that they are able to take nice big deep breaths and don't feel as they are drowning in secretions if we are putting them head down and they're not used to that. We need to be continually assessing them to make sure that they can maintain this position. Okay, my dear, I'm going to go ahead and slip a pad under your bottom so that we can keep everything nice and dry, provide privacy before we ever expose our patient. Go ahead and lift up this leg for me. Fabulous. And if you lift this leg up for me, great. Just going to expose you just a little bit here and go ahead and lift up your bottom. Fabulous. Just try to keep this covered now for a second. Now at this time, I can do some regular pericare. All right, so soap, water, towel, whatever is available in the room for me to do pericare, because we want this area to be as clean as possible before we put a catheter in it. So regular normal pericare, and then we take off our dirty gloves and we discard them into the trash. Cover our patient back up to maintain modesty. And then all these packages have a little perforated end. You just have to figure out which end it is. We can use the packaging for a trash area. You need to be very careful, though, that you do not contaminate your sterile gloves on this by trying to drop things into it. You need to make sure that it's open very wide and that you're just dropping into it if you choose to use that. The next thing that you need to do is review your directions, because some of these Foley catheters require you to check the balloon first. Some instruct you to not check the balloon first. You have to
go with whatever the manufacturer says. That way, if there's a problem with the equipment, that you have gone by the guidelines and are covered, okay? So you need to read all the fine print, usually it's in several languages, and find the number that says, do I fill up the balloon or do I not fill up the balloon? Do I test it or do I not test it? Every time that we open up a sterile field, first is away from us, and then is towards us. We take off our gloves. Take this out. And my dear, I'm going to have you go ahead and get into a position where I can lay this down. This is going to be a extension of the sterile field. I have to be very careful with it. And I'll know that my 1-inch margins are not good, not sterile. Okay? All right, this particular packaging, number 6, says to go ahead and inflate the balloon with sterile water. This green port is where I attach my syringe. And you'll all notice that my balloon is not leaking, and it's doing okay here. So we'll go ahead and let that all down. And I'll leave this connected so that it's ready for me to inflate when I need it. The next thing I'm going to do is I'm going to tear open my lubricant, attach the little lubricant packet to my alligator clip. And I never want to touch the tip of my catheter, so I've exposed the tip of my catheter, and I'm going to go ahead and get it into my lubricant, and it'll maintain protection in the sheath and in the lube. Okay, so the next thing that I can do is I can bring my box down closer to my patient. I can move my table into a position that's good for my patient, or I can take this entire sterile field, not reaching under, but reaching above, and manipulate it next to my patient. Okay?